As we age, we become wiser, we have more experience. With more experience, we get wrinkles. Our face starts to change. So for me and for many of my friends, it's been our crow's feet, our forehead, our frown lines, our jowls, and this turkey neck that we have. There's several options on what you can look at in regards to what makes you happy. One of them is just age gracefully, use skin product, good skincare line, or you can get Botox, fillers, or surgical procedures. So I'm very fortunate that I have one of the doctors that allowed me to video a Botox update and to share what's important to look for an injector and what you need to know in regards to injecting and what fillers provide. So hope this helps you and give you an insight before you make your decision. It's not for everybody, but hope this helps. Happy aging. We're here with Dr. Aguilar. He's going to do some follow-up touch-ups and we will provide further information about what's all involved.
Raise your eyebrows. Look straight ahead. Go raise your eyebrows again. Very good. Interesting. And then we're going to add just a little light touch right here. You did well.
That when an individual is looking at reducing wrinkles or enhancing their features, when they're looking for someone to provide that service, a professional, what should they be looking for?
I think the foremost thing is to go to a board-certified plastic surgeon that has the training to do the Botox, and not just the girl around the corner in the neighborhood that somehow learned how to do it.
Right.
Because the level of knowledge is different in each of those individuals that we've already talked about. And so if you have a complication from Botox, which is possible with anyone, you at least want someone that has the experience to know how to correct it or how to talk you through it.
Right.
And unfortunately, I've seen some non-professionals do Botox in the face to stop, for instance, TMJ pain.
Right.
And they end up paralyzing half the face because they don't realize that the nerve to control the whole face comes out near the TMJ. And if you don't know that, and we've seen that happen many times, dropping a brow is fairly common, but the degree to which a brow will drop can be lessened by the knowledge of the injector. So, for instance, we want the lateral eyebrows to lift following Botox, but not be overlifted.
Right.
And then I think the other point that I need for you to know is that we inherit nerve patterns to the movement of our face from our family.
Oh,
Mom and
interesting.
dad and the generations that went before us. So we can do one spot in 10 people's forehead, the same spot, and get almost 10 different reactions.
Oh, you're kidding.
Because the nerve innervation changes.
That's all.
And that's why
weird.
I think a legitimate person like a board certified plastic surgeon or facial plastic surgeon or a dermatologist, they're board certified as well, should see their first timers a week or two later, because the pattern that they use may not be the right pattern, and how are you going to know unless you see them back? And it allows you to get a better understanding of how you, as that patient, responds to their pattern and what they think, because we can amend the pattern based on your reaction, and then every subsequent visit you're pretty sure you're going to get the response you want because we've learned.
Right.
And I think that's an important part that no one really talks about.
No, it's never been explained to me that way, so
Right.
Thank you for that.
You're welcome. So
Yeah.
It's just important that pattern is everything, and the knowledge. The amount is not as important as the pattern, because we can add amounts later,
Right.
but it's really important to learn how your particular face works with the innervations that you've inherited.
Correct. So I mean, that's important to know. But what about, I don't have fillers, but what about people that do get fillers? What do you suggest what they do and what they should look for? Because you see some people that they look.
Well, yes, I mean, obviously fillers can be used in almost every part of the face. So a lip filler is a whole different discussion versus a cheek filler versus the nasolabial folds, which are these depression, versus the bottom of the chin area.
Right.
So all those fillers are different. And then some people use fillers in the eyes. But again, you have to be very careful and know which filler to use in which spots and what you're trying to gain from that filler. One of the largest misconceptions and myths is that fillers can actually lift a face. Well, they don't really lift a face. They fill a face outward because you're filling something, and that gives you an illusion of lift, but it doesn't really lift.
Yeah.
So I think that's the biggest myth I'd like to attack right now, and we can talk more.
That is an important tip. It doesn't lift, ladies and gentlemen. It just provides the filler. So stay tuned, and we'll have more tips in future episodes. Thank you.
Thank you.
Thank you so much.
That's good.